Urinary blood, small thing or sign of death. Imagine, one beautiful morning, you step out of bed, pull the curtains to let the sunlight into the room. It's a day like any other. You go to the bathroom, turn on the faucet to wash your face, then leisurely pee. But at that moment, your eyes freeze, your breath catches in your throat. In the toilet, the water is no longer the familiar pale yellow. It turns red, a mottled red, pink, mixed with a bit of dark brown. Your heart pounds, sweat pours out, and the question flashes through your mind. Am I bleeding internally? Is it cancer? This is not a scene from a horror movie. This is something I, a urologist, have heard from patients over and over again. Doctor, I peed blood this morning. I was so scared. I didn't dare eat or drink anything all day. And I'm sure that, at least once in your life, you've heard someone mention the phrase, blood in the urine. Sometimes it was a friend, sometimes a relative, and maybe you yourself were bewildered when you saw the strange red color in your urine. The strange thing is, while many people consider it extremely serious and rush to the hospital, many others just wave it off, thinking it's probably just internal heat. Drinking cold water for a few days will cure it. That subjectivity sometimes steals their lives, because behind the two seemingly simple words, blood in the urine, a maze of hundreds of causes, from mild, easy to treat, to deadly cancer. I still remember a patient named H, 52 years old, a bricklayer. He came to see me with a calm face. Doctor, please take a look. I've been peeing a little blood lately. It must be an infection. When I asked him carefully, he said there was no pain, no burning, only occasional red urine. Because there was no pain, he thought it was nothing to worry about. But the results of the cystoscopy made me ponder. A small tumor was growing in his bladder. Luckily, it was detected early, and after surgery, he is still healthy today. But if he had ignored it for a few more years, perhaps the story would have ended differently. You see, blood in urine is not always the same. Some people have bright red blood, some have dark urine like cola, some only have a few drops of red at the end of the stream. Each type is a clue, a message from the body, saying, something is wrong with me, and our doctor's job, like a detective, is to put those pieces together to find the real culprit. To help you visualize, imagine the urinary system as a plumbing system in the house. The kidneys are like filters, filtering blood to create urine. Urine passes through the ureter, down to the bladder, and out through the urethra. The entire pipe is lined with a thin layer of mucosa, which contains countless tiny blood vessels. Normally, urine flows smoothly, without any problems, but just a scratch, a stone, a tumor growing, or a blood vessel bursting, and drops of bright red blood mix into the water. Someone asked me, Doctor, why is blood sometimes bright red, and sometimes dark brown? I often laughed and said, blood is like ink. It is bright red when printed, but after a while it turns dark. New blood, flowing immediately after urination, will be bright red. Old blood, stagnant in the bladder before coming out, will be brown or black. Sometimes, dark urine is not real blood, but hemoglobin, when red blood cells are broken down in large numbers in diseases such as malignant malaria. Another patient wondered, why is there blood sometimes at the beginning of the stream, sometimes at the end, and sometimes the whole stream is red? This is the interesting part. If blood comes at the beginning of the stream, the culprit is usually in the urethra. If it only drips red at the end, the problem is usually in the bladder. If the whole stream is red, it is likely that the blood is from the kidneys or ureters. You see, just by observing a little, the body can tell us a lot. One summer afternoon, I met a young girl named L, 24 years old, a final year student. She trembled and said, this morning I peed blood, red like menstruation. I was so scared. When asked further, she confessed, it was very painful and burning when I peed. I had to push little by little. I smiled and reassured, this is most likely just cystitis. Don't worry. Indeed, the urine test was full of bacteria. After only a few days of antibiotics, everything returned to normal. In this case, Hematuria is not too dangerous, but if left untreated, the infection can spread to the kidneys, causing nephritis. Then the consequences are much more serious. On the contrary, there are also cases that startled me. A 68-year-old man, healthy in appearance, came to the clinic because peeing blood without any pain. I asked carefully. He said, "No burning, no fever, no stones, just blood." Experience told me this was a very suspicious sign. The ultrasound and cystoscopy results confirmed early-stage bladder cancer. The old man sighed. Luckily, I listened to my daughter and told her to go to the doctor. Otherwise, I would have ignored it. In addition to cystitis and cancer, another common culprit is urinary stones. Anyone who has experienced renal colic due to moving stones will remember it for life. The feeling of pain spreading from the back to the lower abdomen, with a sweating, nausea, accompanied by blood in the urine. A small stone, seemingly harmless, but when it rubs against the mucosa, the scratch leaves a red urine stream. Sometimes the blood comes from trauma. People who fall off a motorbike, are hit in the lower back, or have a work accident can all cause the kidney or bladder to tear and bleed. These cases are often easy to predict because the blood appears immediately after the accident. But there are more hidden causes that are much harder to detect. For example, vascular malformations in the kidney. Among billions of tiny blood vessels, just one bulging or ruptured vessel enough to cause hematuria. Diagnosis of this type requires CT, MRI, and even vascular intervention. Many patients are surprised. Why do we have to do such an expensive test for just a small drop of blood? I often say gently, because we don't want to miss cancer or abnormal blood vessels. That's your life. There are also causes related to systemic diseases. People with glomerulonephritis, an internal disease, may have blood in the urine with proteinuria. People with systemic lupus erythematosus, diabetes, or taking anticoagulants are also prone to bleeding. Patients with malignant malaria in the past often experience hemoglobinuria, urine as black as cola, an unforgettable image in medicine. As you can see, the list of causes is hundreds of years long. Some causes are easy to guess, some are tricky, requiring doctors to patiently search like detectives. But the most important thing is, hematuria should never be ignored. I have witnessed patients who lost a golden opportunity because of subjectivity. A 35-year-old healthy man saw red blood in his urine, thought it was due to playing too hard, and ignored it. A few months later, the bleeding became heavier, accompanied by pain. When he went to the hospital, it was late-stage kidney cancer. The price of such subjectivity is fierce. So, what should you do when you discover hematuria? The simple answer: go to the doctor immediately. The doctor will ask carefully about the time, color, and level of pain. Then, a urine test and kidney bladder ultrasound are basic steps, with low costs. If necessary, endoscopy, CT scan, and MRI can be performed to find the cause. Many times, it only takes a few days to find out the culprit, and treatment is simple. If you go to the pharmacy and buy a few antibiotics, thinking it's just inflammation, then you are gambling with your own health. Because if the culprit is a tumor, then you have missed the golden period for treatment. To end today's story, I want you to remember one thing. Blood in the urine is an SOS signal sent by the body. It may be just a mild inflammation, but it could also be a warning of death. And you cannot know for sure until you are examined by a doctor. So, next time, if you or a loved one sees red in the urine, don't hesitate. Don't be subjective. Go see a doctor, because health is something we only realize its value when it is lost.